Hi everyone, welcome to the Hearing Homelessness podcast series, where we'll be discussing local homelessness and the complexities of the homeless experience. My name is Alyssa Enns, and I'm the project leader for the Leamington Homelessness Project at South Essex Community Council, and I'll be your host for this podcast series. Today I'm joined by Melissa Wickfield and Amy Visser to discuss the complexities of homelessness with a focus on health.
My name is Melissa, and I am a mental health and addiction worker for the Canadian Mental Health Association, and I work in the Focused Recovery Program.
My name is Amy Visser, and I'm the Hepatitis C Program Coordinator with the Windsor-Essex Community Health Center.
Awesome. Thank you both for being here with me today. I'm really excited to have you both chatting about the intersection of health and homelessness. So to kind of start our conversation off, I'm going to read out a few stats from Naheed Jasani's TED Talk. So Naheed Jasani is a palliative care physician at Inner City Health Associates and William Osler Health System, providing care for the homeless and vulnerably housed, and exploring the connection between homelessness and health. In his TED Talk, he shared some kind of alarming data. So compared to the general population, the homeless are 28 times more likely to have hepatitis C, are 5 times more likely to have heart disease, and 4 times more likely to have cancer. The average life expectancy of the homeless is 34 to 47 years old, and for the average Canadian, this is 77 to 82. So this means that those experiencing homelessness die at a rate 2.3 to 4 times more than our general population in Canada. In fact, in 2014, a report out of British Columbia confirmed the fact that homelessness cuts a person's lifespan by 50%. So it's clear that there's a connection between health and homelessness. Melissa and Amy are here to sort of unpack that further with us through the lens of both physical and mental health. So with this context, we'll kind of get into the questions, but just to kind of get us started, how does experiencing homelessness affect a person's physical health or mental health?
Well, I would say that homelessness in healthcare or health is complex and it can be bidirectional. So either the person's health concerns are exaggerated by their homelessness, or their health concerns can cause their homelessness. So, for example, if you have a person that's living in a crowded shelter, they're susceptible to communicable diseases, they're susceptible to assault, they are on their feet for long periods of time, causes foot care issues, the malnourishment can lead to diabetes, so that can be how the health concerns come out. And then on the flip side, you can have someone that's housed, but then suffering from mental health issues or substance misuse, and that could lead to their homelessness. So it's a really complex issue when you have it moving from both directions.
Right. Yeah, I agree with Amy. And when we look at housing and health, housing is what they call like a social determinant of health. So based on somebody's housing situation, it really affects, how their health and well-being are going to be, right? So, that right there, not having housing, already puts somebody at risk for whether it's physical health issues or whether it's mental health issues. There's a lot of things with regards to, somebody affecting their mental health. And I would say that one of them is the fact that, it puts them at risk of increasing or exacerbating any current mental health symptoms if they are becoming homeless when they have a mental illness as well. It puts them at risk for increased depression. It puts them at increased anxiety, more likely to be victimized. And that on top also plays in the part that, they might not be able to easily access their medication. Their worry needs to be more about the basics. Where are they going to sleep at night? Where are they going to eat at night? And that can play a really big part in, their ability to maintain mental wellness. One of the individuals that I worked with fairly recently, said to me, I didn't have any mental health issues, but they said when I was homeless, I was depressed. When I'm living in my car, I'm depressed, and she stated it very, just very matter of fact.
Mm-hmm. I agree with it's hard to treat someone when they're homeless because their health concerns aren't their first need. So their first need is safety, their first need is housing and food. So for us, for our program, we will go out and test someone and say, well, you've contracted hepatitis C and we can cure that for you, but you have to follow a medical regime to clear that. And that's what makes it very hard because the person might be motivated to want to clear their infection, but it's just so far down the priority list that we end up helping them address the first factors: housing, safety, mental health, stability, and then treating that secondary infection, which can get worse and worse over time depending on what it is. So other things that will kill you faster are blood infections, which is quite common, and it's with people like if they're reusing needles and there's old blood in the needles and they're flushing that into their veins, they'll get a blood infection, and that will kill you faster than any kind of underlying hepatitis or diabetes or anything like foot problems, exposure. That is a main issue. So then we offer harm reduction to try and combat that issue.
Right.
So there's always, I find that we have all these Band-Aids, but there's no real solution. I don't know how you feel about that, but
yeah, I definitely agree with Amy. When she was saying that, when I was preparing for this today, I was looking at Maslow's hierarchy of needs, right?
Yeah.
And, you just need your very basics. And if those aren't met, how you expected to do the other stuff, right? If you're not sleeping, it's going to exacerbate, again, more mental health symptoms if you're dealing with mental health, right? And when you're homeless, I have seen, just in the news, not in person, but where they talk about, homelessness communities and stuff like that. But for the most part, homelessness is isolated, right? And so just, being homeless and sometimes struggling with mental illness, it can really decrease the lack of community and social connections, and it increases, people's vulnerability. There's a lot of financial insecurity around it.
Yeah, no, you both make great points, and I think it really, it's making me think about, we talk a lot about a housing first approach and why that's so important, and Amy, you mentioned the fact that some of these things, health-wise, are just so low on people's priority list by comparison. And, while that's very true, I think it's also important to note that even if it was high on their priority list, without housing, you're just not able to take care of those other pieces, right? So, I commend you both for the work you're doing, first of all, on trying to address those pieces while also supporting people in their homelessness journey. And then one of the things I also wanted to touch on that kind of came out of that, Amy, you talked a little bit about, harm reduction and those pieces. So one thing I wanted to ask, because we know that one experience that affects both a person's physical and mental health is that of substance use and addiction. We know that there tend to be stereotypes surrounding substance use and homelessness, and there's a lot of stigma surrounding these experiences and the intersection of the two. So is there a connection really between homelessness and substance use? If so, what does that relationship actually look like? And are there any sort of common misconceptions about the relationship between the two? I know that's a loaded question, so.
I'll start with this just because I kind of bump up against this a lot with when we're talking to doing media interviews or anything like that about our harm reduction, about our program. I wouldn't say substance use is indicative of homelessness or homelessness is indicative to substance use. I would say that if you have substance misuse disorders, it can lead to homelessness. Definitely there's people that are experiencing homelessness that are using substances, but it's not all people that are homeless that are using substances. And even the people that we interact with at H4, so H4 is like the hub for services in Windsor, people that we interact with there, will explain, do you want to get tested for hepatitis C? Have you been have you been in contact with contaminated blood? And we explain how that happens. And they may say, no, I'm not a drug user. No, I'm not a drug user. And I say, okay, well, this is other ways it can happen. You might be picked by a needle. Dried blood, hepatitis can live outside of the body for a number of days. You may come in contact with dried blood. We want to make sure that they're safe, but the first thing they always say to us is, I'm not a drug user. And they want to make sure that we're not labeling them as a drug user, because so our wider society says in their mind, if you're homeless, you're using drugs.
Yeah.
And I think that is a real problem, because it's really not true.
I agree with Amy, and you know what? Everybody's situation is different. So, I mean, you can't take the fact that somebody's homeless and assume that they're using drugs or have substance misuse, right? People with mental illness, you can both have depression, but the depression can present itself in different ways for different people. And same with addictions. Yes, we see that, sometimes, addiction can lead to homelessness. We see that through sometimes, people are, using and, their bills aren't getting paid, their rent isn't getting paid. But what's the reason why they're using, right? Sometimes they're trying to self-medicate for a mental illness, right? So we do know that, yes, it can play a part. It's not everybody's story, right? But we also know that having a mental illness can sometimes lead you to, everybody wants to feel good, and substance misuse is sometimes the route that we take. Sometimes we never knew that we were diagnosed with a mental illness, right? Sometimes we knew there was some problems along the way, but until, we get the proper treatment or, connect with the right people or the right door, we might have never known, right? So it's, I think it's a stereotype, and it's unfortunate because that's not the case, for everybody, but it is a common misconception, and that, according to the Center of Addiction and Mental Health, they said that more than 50% of people with substance use disorder have had a mental illness in their lifetime. So there is that connection, but it doesn't mean it's everybody's story. So it's just important to acknowledge that and remember that.
Absolutely, and I can only imagine the way those stereotypes sort of play into someone's ability and willingness to access support. Like you said, Amy, everyone's first thought is to make sure people know that they're not using drugs. And I can just only imagine what that does to someone's, willingness to reach out for support when they need it in those situations. And then there's the element of certain aspects of the homelessness service system not necessarily being a safe place for those who might be dealing with addiction, right? So thank you both for that. This is also kind of making me think a lot about the importance of trauma-informed care. And I'm going to tie this in with just saying that, I think within the healthcare system, and maybe you can both speak to this a little bit more, there can be a sort of mistrust of healthcare providers, or even within the larger service system as a whole when it comes to homelessness. I just think with anyone with structural vulnerabilities, for that matter. So with this in mind, why is a trauma-informed approach so important for that element of trust?
Our team, I know we have talked earlier, our team works from a model of trauma-informed care, and it really started to become more evident during the pandemic because we saw people isolating even more. Before, they used to come into our street health clinic. It was an open door, there was no buzzer, there was nothing like that. And then when the pandemic happened, we had to put those measures in place. So we had to put a buzzer on the door. We had a security doing screening. So it changed it from a place that was more of an open door to more restricted healthcare mainstream kind of idea, and that just didn't work for our clients. So our team, which had one mobile element, which was an outreach worker, we switched our nurse practitioner, myself as a coordinator, our social worker and our outreach worker and our nurse to a mobile team. So we go out to the people instead. We do blood draws. If they won't go to the lab, we'll go and do the blood draws. If we have to go do a counseling session at H4, we'll go do that. If we have to do it in front of their house, if they're housed, we'll do that. So it's taking the obstacle of accessing the care and putting it more in control of the client's needs. So instead of having them, re-traumatized by an issue they may have experienced at the ER, say, we're having them kind of direct how they want their care, which I think is a great way to kind of sum up that trauma-informed care model. We're trying to reduce that level of injury to them.
Mm-hmm.
That's a great response from your agency to reach out like that, because the trauma-informed care model really comes from the fact that you should be under the assumption that everybody that comes to you has experienced some sort of trauma in their life, right? And trauma is really about people's perceptions. So what might be traumatic to you might be very different to Amy or myself, right? And it really is coming from, the perception, or just it's coming from compassion and understanding of the person. Because again, like Amy's saying, we don't want to re-victimize them and cause more trauma, and it's really being where they're at to offer them the empathy and to give them choice and control over their life, right? And to listen. So somebody who's working from a trauma-informed approach, is more likely to build a therapeutic relationship and connect better with somebody when, they're like, I'm here with you, I'm here for you, and really listen to everything that's being said, even if, the individual who's providing the care, is kind of questioning some. Just giving that time and that listening can really build a proper relationship and can actually get somebody to feel positive about their experiences with community supports, and it can engage them and get them moving in a direction where they want to go.
For sure, yeah. And I think one of the things with that too, and I mean, Melissa, you kind of touched on this when you said we need to assume that everyone is coming to us from a place of some sort of past trauma. And I mean, homelessness in and of itself is a traumatic experience, right? So I thought that was really interesting, especially also with what you said, Amy, about being able to remove these obstacles, because when we have folks who have been sort of consistently failed by our systems, whether it's the homelessness service system, healthcare system, what have you, being able to remove those obstacles and make them feel supported in accessing that support is huge. I think that makes a huge difference. And I do want to kind of dive in, I guess, a little bit further into that obstacles piece of things. So, in your experience, I guess, with what you've both seen in your work, what are some of those major obstacles to accessing support for folks that are homeless?
I think one of the main obstacles is the funding that is available. A lot of our funding is determined on data that's collected that's inaccurate. So you're collecting data on the homelessness population in a specific city, but you don't see 25% of that, right? So like you're seeing some of it, but you're not seeing all of it. You're not getting that holistic picture with those pit counts. So say let's take Leamington. If they do a pit count, so a point in time, period in time, point in time.
Point in time,
Yeah. So if they do that kit count, and they say, oh, we have only a 10% homelessness rate in Leamington. That doesn't count all those people that are couch surfing, that are living with family members, that are underhoused. That doesn't count that. And so the funding doesn't materialize because it's not seen as a problem. So I think that's one of the biggest obstacles, is getting those programs in place that can offer supports.
So when we look at rural communities like Leamington, we have a large hidden homeless population, like whether it's people who are couch surfing or tenting in fields or whatever it may be. It just looks a lot different, and you're in less urban areas to connect with those services. And I would imagine, maybe you guys could speak to this a little bit more, but I would imagine that those who are couch surfing, for example, might have very different health needs than someone who's sleeping rough outside.
Yeah, I mean, someone that's sleeping rough, they're obviously going to have higher healthcare needs in the immediate, just from exposure, or depending on the time of year, like they can suffer exposure. They're vulnerable to assault, that kind of thing. Where if you're sleeping, I don't know, couch surfing or kind of camping in someone's backyard, at least you have those immediate amenities, right? I guess you want to say immediate, like, needs taken care of. But then you might not focus on your other health needs because you're like, okay, what's my next step? And then you're also invisible to those outreach workers and those mobile teams that are going out because they're not seeing you, and you might not even know they exist. So you could be staying at your friend's house and have, like, say you want to get treated for Hep C, but you don't know how because your family doctor doesn't do it, and the only other medical thing you know of is the ER, and you don't want to go there because you know how long you'll have to wait, and so, and you're not sleeping in a shelter or being, like, met by an outreach team, so you never know about the mobile medical access. So that, I think, can be limiting for those people that are couch surfing or, you know, hidden homeless because they're not seeing the services that are there.
For sure, which is just another obstacle, right?
Exactly, yeah.
So I think when it comes to, you know, the homelessness and the barriers, you know, it's really important for a variety of different agencies to have outreach, you know, to meet the people where they're at. Again, like Amy was saying, you know, that people are getting missed. You know, sometimes it's because of their situation, whether it's couch surfing. If the workers don't know these things, you know, it's really hard to reach out. I know from working with the population that I do, that sometimes, you know, people can go missing, right? And I'm sure with Amy's population as well too. You know, sometimes people are engaged, and next thing you know, you can't find them, right? So, and some of that plays into homelessness, right? You know, somebody might have been staying here, but maybe they were asked by the police, you know, to move, right? So, you know, all that sudden, that person, their needs are, okay, where am I going to set up my tent if they're staying in a tent, or where am I going to go for the night? How can I access food again? So it can become, like, really concerning. Often some of these people who are homeless don't have access to phones. So you know, if you're not an outreach service, you know, how do you connect with them? You know, if you've had test results and, you know, your nurse practitioner, your primary care needs to follow up with you, how do we get a hold of you, right? You know, you just kind of go out and you have to try to look for these people, right? So it really affects, being homeless really affects, I would say, a good continuity of care, whether it's mental health, whether it's physical health. It's really difficult for these individuals. It's difficult for us as workers too, you know, because, you know, we want to see them do well. We want to be able to help them. But the situation that they're in is already setting them up to a disadvantage, right? So it's really difficult to do, you know, and a lot of these people don't have mailing addresses. So even to mail something to say, hey, we need to contact you, or we've been attempting to contact you, makes it difficult and very, very, very challenging. You know, I mean, people just, you know, they need to focus again based on that hierarchy of needs, just on their basics. You know, where am I going to eat? Where am I going to sleep? Is there a public washroom available? In the winter, a lot of these individuals don't have anywhere to wash up or to use the washroom.
Absolutely.
And in the summer in the community, some of these community, you know, amenities or places to use the washroom are locked up at certain times, right? So just, you know, being homeless just presents a lot of barriers to people, a lot of challenges.
And I would say too, just along the lines of trying to find people to provide that continuity of care. It's important for organizations to like really work together. So like a lot of my job is making connections with organizations. How can we provide wraparound services? So that's the idea of the hubs, right? Like the hub for services in Windsor is they bring everything to one place so you can provide that wraparound care. One of our priorities, right, of our priority populations is homelessness. So when we have identified someone with hepatitis C and say they're homeless and they have mental health issues, they could be on our list. We know that we are trying to maintain contact, we're trying to deliver care. They could be on the list for 2 years. And so what we were seeing is intermittent hospital stays. So we made a partnership with Hotel Dieu, and when someone is in like TNI, so long-term psych care, or P3, which is psych 4, they refer them for hepatitis C treatment. We order the meds, the blood work, and they're kept in hospital while they go through the course of treatment and then release. Because we were finding that it was just a cycle, right? They refer, this person's hep C positive. They release from the hospital. We can't find them. So now the hospital is holding them, which is great. If they have the availability, they can hold them. Hepatitis C treatment's 8 weeks. We can get it done in 8 weeks, so the person is cleared. And then at least that's one thing off that long list of health concerns.
For sure.
So having that networking and those tables of community partners to get together to provide that like wraparound care is so important for this population.
Absolutely. I think that that coordination and collaboration piece, even in the other conversations we've been having for this series, has been one of the major themes in terms of providing that really effective support for folks who are experiencing homelessness. So I'm hoping we see more of that making its way out this way. I would say we've got a good start going in Leamington, but hearing about all these awesome things that are going on in Windsor would be great too. I think there's always opportunities for replication. So it's very cool to see. And I also think, in terms of collaborating amongst communities, what a great thing that is that we can be doing to support the health of everyone. So I want to commend you both for the work that you are doing. It's really important to have people on the ground doing these things. And I think, when health can't be folks who are on the streets priority, it's great that it is someone else's who's keeping that in mind for them. So I want to thank you both for the work you're doing and for being here today to chat with me. I really appreciate both of your time.
I was going to say thank you for doing these podcasts. I think they're great, and hopefully individuals that are listening to them can, spark some education or some more thought about the homelessness issue in their area, because a lot of the times it's thought as like someone else's issue or someone else's problem. That's not in our city. That's not in our town.
Not in my backyard.
Exactly. When it's everywhere. We have people experiencing homelessness everywhere. We have people experiencing food insecurity, especially now with all of the costs going up. Food insecurity is a big issue. So you might have someone that's housed, it might be your neighbor, and they might be struggling. So I think it's important to have these conversations, and I commend you for doing them.
Thank you.
And I just wanted to say again, myself too as well, thank you for having it. I think it's great to spread the word to the community, because sometimes it's things that we don't even think about, right? And really, the answer, to help is connection and community, right? Everybody needs that connection and community. And, I think it's important as service providers too that, we remember these things, and, that we don't give up right away, just because we're having difficulty sometimes, locating somebody. Really realize that, even though it's challenging at times, it's important work that we do to kind of bring people back to try to help them. And I was also just going to say, for anybody who's not familiar with trauma-informed care, or the approach, I guess what I should call it, is the Alberta Health Services has some great free online training. So if there's any community care providers listening today, go check that out. It's free. It's very well done, and for a bunch of different learning types and styles and stuff like that. And hopefully it will help anybody who's more interested in learning more about it.
Oh yeah, that sounds like an awesome resource. Thanks, Melissa. All right, thank you both so much for being here. I really appreciate you both taking the time.
For those who are interested in learning more about the Leamington Homelessness Project, you can visit South Essex Community Council's Facebook, Instagram, and Twitter accounts at South Essex CC, or visit secc.on.ca/homelessness. Through this site, you'll be able to find additional information on the community services offered by South Essex Community Council. That's all for today, and tune in next Thursday for more.